So let's talk about thyroid gland, a hot topic now for years, and based on the number of people that are on thyroid medication, definitely something that we want to be concerned about. Now, there are a plethora of signs and symptoms that indicate there may be an issue with the thyroid gland. More common than not, it's usually a hypothyroid case, meaning that it is diminished function, diminished output on some level of the cascade of the thyroid hormone. A lot of times when this occurs, you see things like the person is tired, sluggish, fatigue, mental fatigue as well, like the brain fog, exhaustion just all around, cold hands and feet, cold extremities, depression, lack of motivation. Let's see, what else? Difficulty losing weight or gaining weight easily, constipation, thinning of the hair. Hair loss is something that we see quite often, especially that outer third of the eyebrows. These can all be things that can lead one to start to look at and at least investigate the thyroid gland, which is a very appropriate step to take. However, just like we try to articulate all the time, the body works in a holistic fashion. Everything is interconnected and interdependent, and some dysfunction seemingly at one place doesn't necessarily mean there's a problem right there at that specific gland or with that specific hormone. There might be a breakdown in the supporting structures or the foundational necessary essential components to have that downstream gland function properly. That's what we want to articulate here. We see a lot of people come in and they're either on thyroid medication already or they are contemplating going on it due to those symptoms, but also due to the blood test. Something to be said about the blood test. If it's based off the blood test, and hopefully by now most practitioners, and if you are getting a panel run, they're running more than just a TSH, thyroid stimulating hormone. That's coming down from the pituitary gland and stimulating that thyroid gland, fire off more thyroid hormone for us. So a lot of times you get a TSH measurement, and a lot of times, at least over the last few years, I am seeing a change in the trend of recent, but a lot of times that's all they were checking. And if that's high, TSH, hypothyroid diagnosis, throw them on some Synthroid or some synthetic thyroid hormone, or even some Armour, which is porcine thyroid gland. But the thing to keep in mind is that thyroid number, and this is true for most blood work, most labs, when we see that, you cannot just look at that marker in isolation and just diagnose or prescribe just based off that. At least it's not advisable. So many things go into play to altering these numbers each day that they shouldn't be looked at in a tunnel, in a vacuum. They need to be looked at thoughtfully along with the person's history, along with the person's current lifestyle practices, and other markers that affect either upstream or downstream the handling of the hormones at play. In this case, we're talking about the thyroid hormone. It can fluctuate based on so many things, so making a determination just based off that blood work measure, you can see why it might be misleading to a certain extent. These numbers, whether it's TSH, T3, T4, free or total, reverse T3, things like that, they can fluctuate depending on the time of the day that you have the test done, the temperature outside, your level of activity or inactivity, what you ate, your diet, your stress levels. And this is all stressors. Remember, physical stress from an injury, chemical stress from any of the bombardment of chemicals we're exposed to, or the most commonly referred to stress, the emotional stress. So you need to take all these things into account, as they can all play a role in increasing or decreasing a marker, and if that is the only thing you're looking at, fueling your decision-making process and perhaps unnecessarily medicating, and perhaps unnecessarily now creating a dependency on an exogenous form of thyroid hormone. As you throw more thyroid hormone at the system, and the thyroid gland says, hey, wow, look at all this, it's high. The TSH that we talked about coming from the pituitary gland, look at all that thyroid hormone in there. Does not signal to the thyroid gland as much anymore. The thyroid gland doesn't produce as much hormone anymore. Over time, this can create diminished capacity to function. So create almost a dependency on the thyroid hormone, the exogenous, meaning coming from an outside source. There are other inroads. There are other foundational aspects, like we talked about, that you can go down these inroads in order to try to enhance function before jumping on the meds. And also some people that come in, they're already on the meds. And this is an interesting one right here because the proof is right in front of our eyes. They'll come in and they're on some dose of Synthroid or even Armor, like we said. We'll start to do some of these things, some of these strategies that we're going to share to enhance overall function, foundational health, but thyroid function as well, and the rhyme or reason for doing so. And then all of a sudden, you'll see these patients who were either functioning at that typical hypothyroid level or a baseline level, all of a sudden they start to shift to more of a hyperthyroid level. And you start to get some of the sleeplessness or some of the shakiness or some of the sweating and some of the things that you'd see more with hyperthyroid. That's showing us that we were able to go in, foundationally support the thyroid gland, and now all of a sudden that medication is actually pushing them overboard into a hyper state. Shows us that we have an inroad to do the right thing. And these patients can often either decrease their dose or come off the medication. So the rule of thumb here is, when you see something like that, rather than jumping right towards the medication, although always a personal preference and the options are out there, perhaps looking to enhance all of those inroads, all of those opportunities around us to enhance thyroid function, enhance the handling of the T4 to T3 conversion, look at our lifestyle, the way we're living, enhance all those things as well, and we can actually create less of a dependency and more of an independent you. So over the next few days, that's what we're going to do. We're going to go over some of the ways that we can do this and explain why you can start to tweak and potentially upgrade that thyroid output and thyroid function.